Good afternoon, everybody. Here with Paul and Josh, and two friends from Bristol Health and NAACP, because we're working really hard, not just to get people vaccinated, to make sure that nobody's left behind, and we get the folks who are underserved their opportunity to get vaccinated, what that means for their health and the greater public health. But I got a full slate here, so let me just give you a couple of thoughts. First of all, the daily summary. Look, we did a lot of testing. The positivity rate is low, relatively low, 3.55, lowest it's been in, more or less for the last few months. Hospitalizations, relatively speaking, the lowest, it's as low as it's been in the last few months. Fatalities exceeded 7,000 now, another 44. But I think what it's important in terms of the positivity and the trend lines is our 7-day average is down. It's down to about 4.4%. We got a lot of work to do, but the trend is still, positive on that front. And we have good capacity in our hospitals. And that leads us to what we're trying to do in terms of vaccinations. This continues to show you that Connecticut continues to be a leader in getting people vaccinated. Now we got to make sure the right mix of people are vaccinated. 300,000 first doses, 364,000 in total. 35% of the folks 75 and above are vaccinated. Let me just take a short pause on that. I mean, given some of the good news you see in our trend lines, there's more urgency or some pressure, I think, to consider reopening. And we're going to give you some clear guidance on that early next week. As you maybe know, some of our neighbors, Rhode Island and Massachusetts, are lifting the curfew on their restaurants. We have a curfew that goes till 10 o'clock. We have higher occupancy, so it's not apples to apples, but it's worth looking at. And I got to look at the houses of worship. The houses of worship, and fundamentally, ending the numerical cap on the houses of worship. There's been some legal cases around the country. You probably know there's some folks outspoken who think now's the time to do that, and I think we're going to do that. Look, I'll be blunt. We're going to have all the folks 75 and above vaccinated or want to get vaccinated, at least with their first dose, within a couple weeks, moving quickly into the 65 and above. Much safer to go to church once you've been vaccinated, go to a house of worship once you've been vaccinated. So err on the side of caution, but these are some changes we're going to make given the nature of the changes you've seen, and we'll be very clear on that first thing next week. Also, good news, met with Jeff Zients. He's the new COVID coordinator, 16% increase in first doses. I think that's going to take us from 46 to 54,000. That's good. Start to use those second doses so we get more people vaccinated faster. And that's never been more important. And those additional doses we're getting right now are going to be focused on those 75 and above in the underserved communities. And let me talk about that for a second. This is a Josh Jabal chart. This is a little test. I'm going to let you read it at the same time I am. But what it says is, look, in terms of those socially vulnerable communities, those communities where folks, maybe they're living in multi-generational housing, densest communities, black and brown folks, those that can't telecommute, going to work every day, those most at risk that impacts their health, their personal health, as well as the community health, because you've seen the possibilities of flare-up. We've only 23.5% of them have gotten their first dose. Compared to overall, the broader population, it's 33.6. It's actually over 35% now. So what I'm trying to say is, for the greater good of the public health, as well as those particular communities, we're making a special effort to make sure that high-need group, that 23.5%, who are right now underserved in terms of vaccinations, just like we had to do with testing a few months ago, making a special effort in terms of vaccinations. And that's what I'll talk about here. How are we doing that? First and foremost, okay, I got it. I don't like vans. I don't have email. I'm not very good on the internet. So we've expanded the telephone, 877-918-2224. I say that with trepidation because everybody may call. But I understand how important that is, especially for those who are older, like myself, who sometimes I even find Amazon confusing sometimes. So we're making this as easy as we possibly can for you. We have 80 additional people who are taking the calls. Many of them were doing track and trace before, but as our infection numbers go down, a little less to track and trace, they're going to be answering your phones. Wait time's down to 3 minutes. I said, show me. So I called that number, 918-2224. They direct me. I said I wanted to go to Rentschler Field, and a wonderful woman named Ellen called up in no time at all. And she'd been doing track and trace. It was her 5th call. I told her I'm calling everybody to thank them for what they're doing. We're doing everything we can. Beyond Rentschler Field, we're going to be booking 6 additional sites statewide. You'll be able to access them off of that same phone number. I think that's on Monday. We're rolling out our retail outlets because as we begin to finish up our nursing homes, obviously in our hospitals, we're going to make the vaccine more readily available, at those mass distribution facilities and centers and our retail locations. I see 14 are already open at Walgreens and CVS. We provided a lot of guidance to our senior centers, helping people with enrollment, calling out to people, letting those 75 and above know they are eligible. Can we help you make an appointment? Working with our community partners. And also focusing on the congregate facilities. I think we mentioned earlier this week, we're the first ones, I think, in the country are just about to do homeless shelters. Again, those folks are underserved, most likely at risk to the community. Angel pointed out we're rolling out the Department of Corrections. I think that's starting first thing next week, starting with the corrections officers and inmates over the age of 75. And we have, I think it's very many senior housing mobile clinics. So just like we did with testing a few months ago, bringing the vaccine to you and making it easier for you to get vaccinated and what that means. So this, I just love this quote, to tell you the truth. This is why this is here. We're reaching out to vulnerable seniors. You see what that means. But the Hill is a community in Greater New Haven that feels they've been left behind for some time. And as Alderman Ron Hurt said, the Hill has been the last in everything. But now we're finally the first because we brought the mobile testing van there and we brought the mobile vaccination there, and there are people getting vaccinated, making it easier for you to keep yourself safe and your community safe. What are the results of all these vaccinations? What does it mean? I think we've said before that one of the reasons we wanted to prioritize the nursing homes was they're the ones that, most likely to suffer severe complications and most likely to have to go into the hospital. And we're doing everything we can to preserve capacity in the hospitals. So we are the first state in the country to get everybody their first vaccination, or first or second, in the nursing homes. That's important. As you can see, the number of residents who are testing positive is down by 2/3 in about 3 weeks. And that will continue to be reflected in terms of hospitalizations and, pray to God, reflected also in terms of fatalities. Safe at school, I was sort of intrigued to see the CDC, Center for Disease Control, rolled out and reflected what we've been saying for quite some time, that schools are not a driver of transmission. You're less likely to pick up the virus at school in the classroom where you're wearing a mask than you are in the greater population. And I think that's good news is being reflected in the confidence of our parents and teachers. I think we're well over 50% of our schools now have full-time in-person learning. Obviously, if a child or a parent doesn't feel comfortable with their kid going to that school, they can learn from home, but at least they have full-time in-person available. And almost all the rest have hybrid as as an alternative. Very few that are all virtual at this point. You know, with that, I made a big deal about how we're working hard to go to the populations that are toughest to reach, how important that is for their health, how important that is for public health. And I'd like to introduce to you Kurt Borowitz. He runs Bristol Hospital. Bristol has really taken the lead in terms of outreach to the greater community, especially a black and brown community. And he's got some pretty good help, and a great guy named Eric Clemens, who maybe you've seen is the voice of sports here in the state of Connecticut, and now also doing outreach on behalf and making sure the communities that didn't always feel confident and comfortable getting the vaccine are doing so. Over to you, Kurt.
Unmute, sorry. Governor, thank you so much for that introduction, and a personal thank you and for your leadership, your team, Department of Public Health. You have all been working endlessly around the clock since this thing started, and I just can't tell you how much I appreciate that. So we do have this really unique and special relationship with the local branch of the NAACP. It started some time ago. Lexi Magnum was the local president. He came onto our board of directors almost 6 years ago, and has really helped us develop this unique relationship where we do a lot of outreach. We do local community sessions where we bring healthcare providers to talk about their issues in the local churches and things like that. And just back in December, early December, Eric Clemens was announced as the new incoming president of the local branch. And so Lexi coordinated a meeting between Eric, myself, and him. And we started to talk through some of the issues with reaching this really vulnerable community and how we might do that. And what really shocked me was both Lexi, almost exactly at the same time as Eric, said, there's just so much fear. There's just so much concern about, is it safe? Is it okay? And how are we going to convince, the members of our organization that it's okay to do this? So we quickly started to talk about how we were going to do that. And we actually came up with the idea of doing a virtual town hall meeting with physicians and medical staff, which was very well attended. There was almost 100 people that attended that, and the questions they asked were incredible. And I'm going to turn this over to Eric to really take it from there. But again, thank you, Governor, and your team for just an incredible job leading this state through this pandemic. Eric.
Thanks, Kurt. Over to you, Eric.
Okay, Governor Kurt, can you guys see and hear me loud and clear?
We sure can.
All right,
nice
great.
Backdrop.
Well, you would mention that, Governor. Well, I'm actually in California visiting my daughter and my first grandbaby, and this is my daughter's little studio, so it's all glammed up in pink and stuff. It wouldn't be my first choice, but I have to take what I get when I'm visiting, right? Kurt talked about it, the partnership between Bristol Health and the NAACP. It ensures a trust between the community and organizations like Bristol Health and, of course, that community that they serve. Now, in terms of voting drives, we've collaborated on that just last fall. We had a voter registration event. More than 100 Bristol residents registered to vote in that record-breaking in terms of turnout election that we just completed this past November. Kurt mentioned how myself and my colleagues really heard all kinds of concerns, some of them based in rumor and misinformation, others based in some history about how African Americans have been treated in the past by the medical community. And many were concerned about the COVID vaccine. So we scheduled a forum with experts who presented evidence on the benefits of the vaccine and really helped answer a bunch of questions, a flood of questions that came in, general questions that I had never thought of, but really did a great job in, I think, allaying a lot of fears. More than 100 people attended that presentation, and many shared the link to that presentation. That link is right on the front of the Bristol Health website. Right now, you can find that link, and I recommend anybody check it out and look at it and get some answers to your own questions you may have. bristolhealth.org has that link, and again, every question you could pretty much think of was asked of those medical experts. and answered to the best of their ability. And it certainly, I passed along some of the information to my family, and it really did a world of good. Governor?
Thank you very much. Any questions?
NBC Connecticut.
Good afternoon, Governor. First of all, now that all of the nursing homes have received vaccinations, I'm wondering if you think it's time to withdraw the legal immunity that you gave them at the beginning of the pandemic, which prevented anyone with a family member who died or was injured in a nursing home from suing.
Yeah, Kristen, that's one of the things we have under consideration. Give me a little time on that, if you would.
Okay, and we've also heard reports of at least one Connecticut superintendent telling parents that the Department of Public Health has informed school districts to be prepared for the possibility of full remote learning in March due to the potential of a more infectious variant of the virus becoming prevalent in Connecticut. Can you give parents and even employers listening at home a little more insight into what to possibly expect?
Yes, there are several super infectious variants of COVID-19. The UK, which we've had probably 8, I think, total diagnoses here, out of tens of thousands. There's just today we found the South African variant in South Carolina, I think it was. Right now, I think our vaccines are going to be able to stay ahead of whatever risk there is there. Maybe it's 1% of our population is infected with there. It's growing. We don't know how fast it's growing. Scott Gottlieb warns me that in some parts of the country, it's not at 0.1%, it's at 5% or 6%. And those are places where vaccines may not be able to stay ahead or will have a tougher time. I'm fairly confident that if we continue our flow of vaccines, they continue to up the ante, we're going to be having school in March.
Okay, and then lastly, on Monday, you had said about 1% to 2% of the vaccines distributed so far might have gone to people who weren't actually eligible at this time. So that would be about several thousand people at least. Can you provide a more exact number and tell us if any safeguards have been put in place to prevent that from happening again?
I'll pass this to Josh, but 1 or 2%, I think, is a high number. I think the number of folks that have maybe the vaccines should not have gone to them preliminarily. Most of that, I think, was inadvertent. I don't see a lot of games being played. We are following that because there's a fundamental sense of fairness. And people have got to realize we're doing everything we can to make sure the distribution of this vaccine is be done on a fair basis as possible with an emphasis upon public health. Josh, do you have anything to add on that?
I think that's right, Governor. I think the numbers are smaller than that in terms of people who may have inadvertently been vaccinated out of order. And as the governor said, the cases we've seen, we think are honest mistakes. But it's worth people remembering that when they sign up for a vaccine, you do have to do a test under penalty of perjury that you are eligible in that phase. So that's a good reminder. And our DPH licensing team is doing some spot checks, looking at rosters of people who've been vaccinated. So there are eyes on this, but so far, as the governor said, we have an enormous amount of trust and confidence in our providers, both our hospitals, our federally qualified health centers, our local health departments, that they're vaccinating in line with the governor's guidance, and trust in the people of Connecticut, too, that they understand the prioritization, why it's so important to get our senior citizens vaccinated, given the significant challenges with COVID-19.
Okay, thanks.
Channel 3 Eyewitness News.
Yes, Governor, since the Biden administration announced that more doses will be shipped, do we know how many roughly Connecticut might see?
We have better visibility than we had a month ago. The numbers are going up. I was talking to my co-chairman, Bill Lee, about just this. We're reaching out to Pfizer. We're reaching out to Moderna. Reaching out to Jeff Zients, seeing if we can get a better handle on how fast we're going to be able to ramp up production of the vaccine and how that will be distributed, so that governors across the country can get not a 1 or 2 week window, but a 5 or 6 week window, allow us to prepare accordingly.
But we are equipped to handle roughly 150,000 doses a week?
We can handle it, absolutely, and the demand is there.
Got it. And my final one now, since equity seems to be the topic of the day, do we have a breakdown of vaccinations by ethnicity right now?
Do you have that, Josh?
Yeah, so the team is working on that. It's challenging to pull the data together because multiple different systems are being used here. VAMS is the one that people know about a lot, but a number of our hospitals are using their own EHRs, and there's other systems. So the DPH team is working hard to try to get that data cleaned up to a point where we can share it. We certainly want to share it as quickly as we can. I think it'll be a very important lens into how we're doing as a state, as the governor said, reaching some of our most vulnerable populations.
News 8. Fox 61. Fox 61. Oh, I'm muted? Oh. News 8. Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. You mentioned the 16% increase in first doses next week. A two-part question. Where is the increase coming from? Is that from the federal supply? And then second question, is that set to be the new norm, this jump from 46,000 doses a week to 54,000? Or is that just for next week? You're expecting that increase?
It's primarily from the Moderna allocation. It is from the federal allocation, and I think it is the new norm.
And then I know you were just asked specifically about ethnicities, but do you plan on releasing data on just the number of vaccines administered and distributed on a daily basis anytime soon?
Are we going to get that, Josh?
We're working on it. Yeah, again, the plumbing behind the scenes here is still a work in progress. And once we get it to a state where it's easier and more automated, we do aspire to publish it weekly or daily, rather. So yes, that is the direction we're headed.
And then we saw how many doses have been administered so far in Connecticut, but could you share how many doses has Connecticut received since December?
Sure. So when we started the week, we had received a total of just short of 500,000 doses, 495,000 doses as we began the week, and more shipments have been arriving as we've gone through the week. Those are doses that are intended for both first and second doses. So the split there is 354,000 first doses and 140,000 intended for second doses.
And then lastly, I actually just got a question from a viewer who wants to know if the state plans on lifting the 10 p.m. to 5 a.m. closure on businesses before the Super Bowl.
Let me get back to you on that on Monday.
Thank you.
News 12 Connecticut.
Hi, Governor. This morning, your corrections commissioner told lawmakers that a pretty alarming number of his staff either don't want the vaccine or are unsure about it. More than half of them said that they might not get it. Does that concern you? And is there any situation where we might have to require them to get the vaccine to be around inmates?
Not at this point, but we're getting the vaccine to people, like you said, corrections officers, those over 75. It only works if you take the vaccine. And you know, we found the nurses at the nursing homes, there was a little hesitancy early on, unlike the residents. By the second time we came around, I think that number went up quite a bit.
But what happens if enough prison guards and staff members just won't get the vaccine? I mean, how do you keep an outbreak from happening if they just won't get it?
Let me see if I have a problem there before I have to answer that question. I think we're finding in our other situations where there was some hesitancy early on, people build up confidence, their friends get the vaccine, they see their friends getting the vaccine, they hear that it's effective, and I think you're going to find overwhelmingly the corrections officers will get vaccinated as well.
All right, and just one more question. I want to follow up on the nursing home immunity question. You might have seen that State Senator Matt Lesser filed a bill to repeal the immunity. Any response to that?
Yeah, let me take a look at it. it may be that time, but you had the previous question about these super spreader, highly infectious variants that are coming around. So obviously that adds to a risk profile. But I think it's probably time to take a look at that immunity provision.
Have there been any discussions with lawmakers about that, whether they want to just take that up on their own, since you offered to let them deal with these orders one by one if they want?
Hey, Paul, do you know about that?
No, I know we've seen the tweets that's been sent out by Senator Lesser and other members of the legislature that's been monitored by our staff. But I think this is a perfect example, as the governor stated during this time of the emergency orders, that the legislature has the ability to take them up on a one-by-one basis and go through the usual legislative process. And we welcome them to do that. And when the conversations need to be had, we're ready to have it. But as the governor stated, he'll be reviewing that and every other order that's current when a new emergency order time frame begins around 9 a.m. on Friday.
And I'm sorry, just one very quick question too. You've instituted the cold weather emergency protocol. Can you just sort of talk about what that means in terms of shelters and vulnerable populations?
I can start. We had to get that information out to people. It's going to be extraordinarily cold, unseasonably cold over the next 3, 4, 5 days. And I want to make sure that everybody is safe and get them so they know where they can go and be safe. Paul, anything else on that?
Yeah, Governor, I'll also add that allows us to also provide support to municipalities to be able to open up cold weather shelters and make sure they're properly reimbursed for that effort. It also gets all of our agencies and the appropriate people within our agencies to be prepared to respond to any requests coming through our web EOC system. So as the governor stated, we like to put that out in due time, much earlier than the cold weather hits the state, so everyone is prepared and ready.
WTIC 1080 News.
Governor, you've been a proponent of open schools, not a driver of transmission, as you said, and yet in March it sounds like there's a lot of caution. Could you go a little deeper on that? You know, why should people believe that that schools are not transmitting the virus, and yet you're really concerned about things going downhill if schools open further?
No, it has nothing to do with the schools opening further. I think you're finding in Europe as well as the United States, schools being open is not where the risk is. I think the question about March, correct me if I'm wrong, were people thinking about, oh my God, what happens if this highly infectious strain takes off in Connecticut like it did in Britain going back a couple of months? What are the fallback positions we have to consider? Right now, I'd like to think the vaccines will be just ahead of that risk, but time will tell.
And are residents at state mental health facilities going to get vaccinated soon? Are they part of one of the next groups?
Yeah, they are part of congregate settings. They are part of this group now. They will be phased in over the next month or so.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, I asked on Monday regarding what percentage of nursing home and assisted living workers have gotten their first shots and what percentage have gotten their second. I didn't hear back from anyone. You say that the numbers are increasing. Just wondering what percentage of the workforce has been vaccinated.
Josh, any
Yeah,
insights?
sorry, that's my fault. I didn't get back to you. We will do that. We think that there's some better federal data that's coming available soon, so I'll follow up with the team and circle back with you. I'm sorry about not getting back to you on that.
Okay, thank you. Regarding the inmates, the commissioner today said staff and inmates over 75 would begin getting vaccinated on Monday. Any idea when the rest of the population would be vaccinated?
Josh?
That's still in the planning phase, and so we're working with the team at DOH, Department of Corrections, DPH, on the logistics around that. So more to come there, but given the population that is 75 and above is relatively small, we were able to, Commissioner Quiros has been able to pull some strings, move people around, and get those folks done on Monday. So more to come on the rest of the incarcerated people as we go, as well as I think there was a question earlier about inpatients at CVH in Whiting. Same thing, Commissioner Delphin Rittman and her team are working on the logistics, setting up the clinics. There's a lot of logistics that go into this, as you can imagine. And as the governor said before, these will roll out over the course of Phase 1B in parallel.
Okay, great. And one last thing, you may have seen today that the Attorney General in New York said that thousands of nursing home residents' deaths may have been undercounted. In New York, they only counted people who died on nursing home property and not in the hospital. I'm just wondering, at this point in the pandemic, how accurate are our death counts in Connecticut?
I think in Connecticut, we're very accurate. Early on, if it was COVID related, we said it was a COVID death. And every state was sort of analyzing that in their own way. Let's put it that way, Sue. But I think you're going to find, you can look at those excess fatality numbers compared to a normal year with this year, and you see that Connecticut is pretty close because we have tried to be brutally accurate.
Okay, thank you very much. I appreciate it.
The Day of New London.
Hi, Governor. I was wondering you had mentioned the 6 sites in addition to Rensselaer Field. Do you have what those 6 sites are that one can schedule through the phone?
Go ahead, Josh.
So as of Monday, we'll be scheduling at Bristol Hospital. So thank you to our colleagues on the line here. They've opened up some slots. We'll also have sites in Danbury, Kent, Middletown, Stamford, and then more coming online as well that we should be able to announce next week in other parts of the state. And as the governor said as well, in addition, pharmacies coming online now, which have been kind of targeted to some of the corners of the state, particularly the northeast and northwest corners of the state where we don't have as good coverage with other providers right now. So as the governor said, we're really working very strategically to make sure we've got great coverage statewide.
And in terms of the second doses for people over 75, we've been hearing some stories of people who went, people over 75 who got their first dose, went home, had to schedule their second dose through VAMS and couldn't get an appointment until, maybe 2 months later. So is anything being done to address that? And what are you hearing from different sites? Are some sites automatically scheduling people for, 2 or 3 weeks later, or others are, leaving people to kind of their own devices for that?
Yeah, no, we are aware there's been a little bit of miscommunication on this topic with a handful of providers. What we are encouraging all of our providers, and most are in fact doing this, is that after people get their first shot, they get that 15-minute observation period, that we want people to get scheduled for their second shot while they're on site that day so that it's locked in. And most of our providers are actually doing that. We're aware of a small number who have fallen behind on second doses, and our DPH team is working with them on strategies about how to get caught up.
And then you'd mentioned the mobile vaccine clinics earlier for seniors, people in senior housing. Who is running the mobile testing? What providers are running testing sites or running mobile testing sites at senior housing? And then also for people who, aren't in senior housing but maybe are homebound, kind of what can they do to get vaccinated?
Yeah, so we have dozens of providers across the state who are doing mobile vaccination clinics. The governor highlighted one earlier that the city of New Haven, the New Haven Department of Public Health was doing in the Hill. Hartford Healthcare has been very active. Many of the other providers around the state are conducting mobile clinics now, going straight into senior housing. And also, I think it's worth pointing out, a lot of municipalities are getting very active on doing outbound calling to the seniors in their communities to help them sign up and to make sure they're aware of what opportunities are available and holding local clinics as well. So it's a very wide-ranging net of providers who are taking a very active role on this outreach.
And then lastly, for people who don't have access to who don't have a car or other access to transportation, what would you recommend for people who don't have transportation but want to get vaccinated or want to go somewhere? Yeah,
so we are, our team at Department of Public Health, working with our team at Department of Social Services, is working on transportation strategies. I know a number of our municipal partners are also taking the initiative to look at providing transportation for people who don't have it, or if there's not, if they're living alone or, they're not in a congregate facility where the vaccines may be brought to them. So there's a lot of grassroots work going on there. I've heard of churches who are adopting quote unquote members of their community and helping ensure that they're getting enrolled and that they are aware of what's available, giving them rides. So it's a tremendous community effort across the state that's going on right now.
Thank you.
Republican American.
Thanks, Max. I just want maybe a quick follow-up with Josh. You said small numbers of providers are having difficulty keeping up with the second dose appointments. Are there any particular geographic areas? I know you mentioned something earlier about the pharmacies in Northeast and Northwest Connecticut. Are these providers spread out across the state? Are they concentrated in particular areas where there might not be as many health care providers as there are in, say, some cities?
They're spread out, Paul.
Okay. And also following up on the Department of Correction, as an employer, can the state mandate its workers get vaccinated? Whether they're a corrections officer or a DOT maintainer?
Paul, do you have insights there?
So employers have the option to legally to require vaccination. It's not something that we plan as a state. As the governor mentioned before, we're very optimistic we'll get good uptake amongst our employees as they become eligible.
Okay. And what's the role of the mobile clinics going to be in reaching the vulnerable communities, and how is the social vulnerability index going to assist in planning vaccinations for those populations?
So it's really sorry. So it's really part of the governor's strategy from day one, which has also been informed by the allocation committee of the Vaccine Advisory Group, that we want to be very deliberate about going out to people who we know are going to have a harder time getting access to vaccine. And so the mobile units are about going into those communities, going into those senior housing complexes. I'd encourage people to look at that article the governor referenced in the New Haven Independent. It's a great kind of case study of how the city of New Haven is doing this really well. And that's really what it's all about. So it's just making it as easy as possible for people to get access and removing barriers. The Social Vulnerability Index is a CDC measure that our Department of Public Health is using to really analyze all the way down to the census tract level that we'll be tracking going forward of vaccination rates amongst the population as we go, so that if we see certain tracts falling behind, we can direct additional mobile clinics and other interventions into those communities.
And I know, Josh, you've been asked in the past about, compiling reports and statistics on contract tracing. I'm just wondering sort of where do things stand there? Are there any evaluations of the effectiveness of contract tracing, assessments on productivity, timeliness, compliance of cases?
Yes. So great opportunity to give a shout out to our contact tracing team, who has done an absolutely unbelievable job. I think when the history is written of this pandemic, Connecticut will have had one of the best contact tracing programs out there. We're at a point now where we're reaching out to cases within 24 hours, 98% of the time. And the team's got it down to such a science that, as the governor mentioned, we've been able to actually redeploy contact tracers to help answer the phone and schedule people for vaccines. And we do think that's having a real impact. The speed with which they're getting back to people, the additional supports we're able to provide to people who need assistance isolating or quarantining. And we are working with our partners at the Yale School of Public Health to analyze more of the contact tracing data too, to see if there's other trends, in addition to the outbreak investigations that we do report on publicly of larger clusters of cases that has been written about in the press before.
Okay, but say, for example, something came up in a workplace, there's someone who is tested positive, but not everybody in that workplace is going to get contacted, right? I mean, it's only people that would be within the CDC guidelines of potential exposure, correct?
Correct.
Okay. And then just one final question for me. Governor, the House Minority Leader, Vin Candeloro, just kind of put out a statement in response to your comments earlier about lifting the restriction on houses of worship. I guess basically he's saying that it was their idea. They publicized it a couple of days ago, excuse me, and now you're announcing it. We saw the same maneuver in December when the governor dismissed House Republicans' suggestion to fund an aid program for our state's hospitality industry, only to announce his own program days later after rejecting our proposal. I don't, anything to...
Not much. I have an open door, and I take good ideas from folks, and I appreciate the good ideas.
Have you been hearing from the religious community? Have you been hearing from the clergy about this?
Oh, yeah. No, there's no question about it. We've been hearing from a lot of houses of worship for quite a while. As you know, there have been lawsuits around the country. It's not a surprisingly new idea saying, why do you have these restrictions? We had it because houses of worship attract a particularly vulnerable population, folks who are older. And so, personally speaking, from a point of view of public health, another few weeks, we'd have a lot more people vaccinated, it'd be a lot safer. That said, let's lift that numerical cap. Let's do it now. But if you haven't been vaccinated, probably it's better to stay home for a little bit longer if you're of a certain age.
Okay, thank you very much.
Thanks, Paul.
The Connecticut Mirror.
Thanks, Max. Couple of questions. Have any congregate settings already been vaccinated? I know there was a pretty big outbreak at Southbury Training School, for example. Have there been vaccinations there, or have any been vaccinated, or is DOC going to be the first one?
I believe we've done a homeless shelter as of a couple of days ago. I think that was one of the first congregate settings anybody has done. The schedule from there, does anybody know?
Yeah, I mean, there's been dozens going on around the state. Again, we had the New Haven example earlier, many more. And basically the way this is working, Dave, is that congregate settings, facilities are working with a number of different options, where if they have an existing healthcare partner that they work with, they're in touch with them to schedule. If they need additional help, our team at Department of Public Health is helping to match them up with a partner who can come in and help provide vaccinations. And then for our state facilities, as I mentioned, we're working with them as well on the logistics of getting those set up and scheduled.
And if I could, I'm kind of like the governor. I need to look at these charts a few more times, but the 23.5% that he mentioned on the chart that you had put together, can you explain exactly what that says, or what that chart is telling people?
I tried my best. You tried, Josh.
Okay. Yeah. So again, the Social Vulnerability Index is a CDC measure of communities that are most likely to need assistance in a public health emergency because of factors related to, size, number of people living in the homes, income levels, other factors that are predictive of being vulnerable to disasters or to public health emergencies. And so, we're looking at the communities in the state that rate high on that measure in terms of being highly vulnerable. And that slice of the data shows that 23% of people 75 and above in those communities have gotten their first dose, versus about 34% in the rest of the towns that are less vulnerable. And so, as mentioned before, we're still working to get the data together on, race and ethnicity, but I don't think we need that data to know that we're going to need to do very focused work to reach out to these communities and make sure that they have ready access to vaccine. This has been written about nationally. I think every state is going to see this, and this is why the governor has been very focused on this from day one, that we're very deliberate about reaching out to these communities, and we're measuring our progress about making sure we're getting vaccine out to them.
And the 5 sites that you mentioned that are going to be mass vaccination sites, are they going to be, if people call the 211 line or this new line, are they going to be directed to some of them, or are people still just being directed to the rent?
So just to be clear, those are existing sites that are going to essentially be allocating a portion of their appointments to the 211 line for scheduling.
So people theoretically may call and get, if you're from Fairfield County, you won't be told to drive to East Hartford. You may be able to go to Stanford, or I forget where the other ones were that you mentioned.
Yeah, and again, there's multiple front doors here. So there's that phone line. You can go on the state's website right at the top now, the ct.gov/COVID vaccine, type in your zip code. It'll pop you over to a map where you can see all of the sites around you, how to contact them. Many of them have their own phone lines, are booking directly. So there's a lot of different options for people to get access, not just that phone line.
Thank you.
CT News Junkie.
Thanks, Max. Governor, you're the DOC commissioner today. In addition to announcing some things on vaccines, he talked about wanting to close two prisons, I think, by October. Any concerns that you reduce the number of facilities that you can house these folks at? You're sort of by definition cramming them into closer proximity to each other, less social distancing.
Yeah, Hugh, we had that conversation with Angel, and he addressed it really well. I mean, we're at the lowest level of incarceration this state has seen in well over, a decade. We've got we will have additional capacity even if these two facilities are closed down later on this year, making sure we have space and capacity in the remaining facilities. Absolutely.
Okay. We've had good news lately on the infection front, but fatalities seem like they've stayed kind of high. It's been only 2 months maybe since we crossed that 5,000 marker. Here we are at 7,000 now. When do we think maybe these vaccines and all that we'll start to see a drop in the number of people dying here?
Look, I'll take a start at it. Yesterday, it's frustrating as heck. Obviously, fatalities are a lagging indicator, but hospitalizations are down, vaccinations are up. It's breaking my heart. We ought to be bending this curve very, very soon. And it's not Connecticut. It's happening in 49 other states as well. Those fatalities are still cresting.
Okay, one last thing. Has there been any talk about sort of lifting travel restrictions on people who have gotten both vaccines already?
That's a good point. We'll be taking that under consideration. But overall, when you see what's going on in some of those states that have the highly infectious strain, and they're popping up right now, we still have to be very careful about too much travel between and among those states.
All right. Thanks, everybody.
Connecticut Public Media.
Good afternoon. You said you added 80 additional people to work those phone lines. Just wondering, how many total do you have working the phone lines and working with the VAM system?
With this 80, I believe the team at United Way is at about 130 people answering the phones now.
And with how things are going, are we still projected to see 65 and up receive their vaccines come February?
Yes, as the governor's mentioned, we think there's probably maybe another 2 weeks or so to go to get everyone in the 75 and older group who wants vaccine to have access.
Thank you.
Hearst, Connecticut Media.
Hey, Governor. Danbury Superintendent is making the argument that communities where there's been high incidence of the virus should have school personnel brought to the front of the line for vaccination. For vaccination. Is that something that you've considered, and if so, how would it be implemented?
Every day I get calls from different groups that ought to be at the front of the line. That's why we've really focused on the most vulnerable population, 75, 65. We're going to have to figure out the essential workers from there, but teachers will be near the front of that group.
Thanks. And then you talked about some of the disparities in vaccination for vulnerable communities earlier. What do you see as the driving factors? I know there's been some discussion of just some mistrust in the medical community from some communities, but what do you see as driving those, though?
Well, I'll start, then maybe Kurt or Eric would want to jump in. But obviously the comorbidities in these underserved populations, black and brown, much more likely to suffer complications. You know, reading some of the reports, much more likely at the age of 65, if you're black, to suffer severe complications from COVID than a 75-year-old white person. So I think a lot of that is in terms of very congested living, and a lot of that is in terms of the comorbidities. But Kurt, do you want to try that?
I think you, Governor, I think you've got it exactly right, and I think that there is a lot of fear and concern about, you know, is this vaccine safe? And so I think the right approach, the right tactic is to reach out to these individuals, reinforce that it's safe, have the conversation, and listening to the conversation earlier about nursing homes and convincing the staff and that, you know, making that second pass through absolutely help people feel more comfortable about getting the vaccine is exactly what we have to do, to keep reinforcing, keep communicating. And the other thing is too, I feel very, very strongly about this is, you know, Connecticut, we're a community. We can recognize people that are in those high risk groups, 75 and older, and really, and, you know, really at risk. And there are friends, families, people maybe that you see in the community. I think it's, you know, it's like everything else, you know, stop, take a moment and ask them if they, you know, if there's something you can do to help them, because many, as you saw earlier in the slides, there's always issues with being able to use the internet at that age, you know, not having the experience, maybe even not having emails, and just saying, look, you know, there's a helpline. Can I help you make the call? Can I take you to the senior center or something like that? So I think, you know, I think this is something we have to do as a community together, and really work hard to do the outreach. Eric, I don't know if you have anything to add.
No, not much. I think you've hit everything that needs to be hit. I think also the communication between those 75 plus year olds that have had the vaccine already can communicate with younger members in their own communities and their own families. They haven't spontaneously combusted. There's nothing, you know, going on, and they're moving along the process, and that helps allay those fears that may come from a lot of misinformation, as we spoke about earlier. So I think it'll be an entire community and medical organizational effort.
Thank you all.
The Hartford Current.
Hey everybody, this is Emily Brindley from The Current. First question, I just wanted to follow up really quickly on Allie's question about the 65 to 74-year-olds. Josh, did you say that 75 plus year olds will be done in 2 weeks, or 65 to 74 will start in 2 weeks? Because my understanding is there's a little bit of an overlap between those two groups.
That's correct. It's not binary. You flip the switch one day. You know, what we're doing is we're talking to Kurt and his peers around the state. We're monitoring the reservations and the appointments, and as soon as we start to see any slack and the demand start to taper off, then we'll start to phase in the 65 and above. So, you know, it's going to depend on the uptake. It's going to depend on, can we get any more vaccines from the federal government? So it's not an exact science.
Okay, thank you. I appreciate that. And then I also would like to ask about the kind of ordering of congregate settings. So I understand that congregate settings are being done on a parallel timeline to the rest of the vaccinations. But what is the criteria for when a congregate setting will, I guess, come up in line for vaccinations? Because we've heard of some congregate settings, obviously like the homeless shelter that has been mentioned, that have already been vaccinated, and then other places that haven't. So how is priority determined there?
It's really a function of them getting organized, right? Getting ready, getting the logistics in place, getting coordinated with the partner that they're going to work with to do the vaccinations. So that's why it's going to take some time to play out, just because there's work to do. There's some complexities there.
So if I'm understanding you right, then you're saying that the state isn't prioritizing particular types of congregate settings. You're just waiting until they're ready?
There is some prioritization that DPH has put out in large categories, but not individual sites. And we can get you some additional details on that.
Yeah, if you could provide those details, that would be fantastic.
Sure.
All right. Thank you, everybody.
All right. Thanks, Emily. And thank you, everybody. Kurt, I really appreciate everything you're doing at Bristol Health and bringing the vaccine to people and getting it done. And hey, Eric Clemens, I see you there on the Zoom screen. I'm going to put you on the spot. We're a little bit bipolar, as you've sort of heard from the questions. We've got an awful lot of people, probably the vast majority, who are desperate to be at the front of the line and get vaccinated first. And for them, it's life-giving and such a bit of relief in this great stress that we have. But you also know there's certain populations, we heard it in terms of the nurses at the nursing homes, we heard it in terms of corrections officers, some of the populations that you're dealing with who are hesitant about this. You've got the concluding word. What would you say to people? Give them the inspiration to do the right thing.
You know, in my lifetime and in people, I mean, when I was a child, mumps, measles, polio, whooping cough, all those things were very common. And vaccinations helped almost eliminate occurrences of those particular diseases that I saw a lot of when I was a child. I think by and large, the scientific and medical community in a pandemic that we haven't seen in our lifetimes in over 100 years has worked very hard to try feverishly to come up with this. And I think that as we see more people be vaccinated and not suffer some strange illness or death or go about life as normal, I think that will go a long way in calming some of these fears that people have of what is the unknown. And there have been a lot of people vaccinated so far, and now hopefully they'll spread the knowledge. Yes, I've been vaccinated, and yes, I'm still here, and yes, I feel a lot better. And I think we'll see a lot of that fear go away, like we talked about earlier with the nursing homes and everything. And I know personally the outgoing president of the NAACP here in Bristol was vaccinated and cut my hair just a few weeks ago, and he looks fine. He seems fine. So, you know, that's one person I know personally that has been vaccinated and gotten his second shot, and he's doing well. And, you know, and I just want to believe that science, the medical community, our government, our community servants and people have our best interests at heart, and that they would never put a vast majority of the population in harm's way just for some whim. I think we can be confident that we're working towards the right kind of solution to this problem that we haven't seen in our lifetime.
One of the tricks in life is know how to delegate to really good people. Eric, thank you for saying that so well and appreciate all your help. Be safe, everybody.